Hey everyone, and welcome. Today, we're going to shine a light on a really vital nonprofit that's making a huge difference in its community. I'm talking about Community Health Connections. So let's dive in and see how they're doing it. So let's just start with a big question. What if high-quality healthcare was truly for everyone? I mean, think about it. In a world filled with complicated insurance plans and all sorts of barriers to access, that simple idea can feel pretty revolutionary, right? It's really the core challenge that so many of our communities are up against. And you know what? That is the very question a group of dedicated people in north central Massachusetts decided they were going to answer. And that brings us right to the mission behind Community Health Connections, or CHC for short. So let's go back to 2002. That's when CHC got its start. And right from the beginning, it was set up as a nonprofit. This was never about making money or competing for market share. Nope. It came directly from the community seen in need, from this shared belief that good healthcare is a right, not a privilege. And that core belief leads straight to their mission. It's super simple, but really powerful. The keywords to focus on here: high quality and affordable. It's all about the idea that you shouldn't ever have to pick one over the other. Okay, so that's the mission. But how do you actually make that happen? Well, the first big piece of the puzzle is their absolute commitment to serving the entire community. And they mean it, no exceptions. And that's a fair question, right? When an organization says they serve everyone, what does that actually look like on the grounds day to day? Well, take a look at this. This is what everyone looks like. It doesn't matter if you have great insurance, if you're underinsured, or if you have no insurance at all. Their doors are open. They're there for low-income families, people living in public housing, and even those experiencing homelessness. The guiding principle is just, everyone is welcome. And this number, wow, this really shows you what that commitment looks like in action. We're not just talking about a statistic here. That's 10,350 people. 10,350 homeless and publicly housed patients who got the care they needed from CHC, just in 2024. I mean, that is a staggering dedication to the community's most vulnerable members. Okay, so that's who they serve. Now let's talk about how they do it. This brings us to the second pillar of their whole model, the power of having everything you need all under one roof. I mean, just think about it. You know how frustrating it can be, right? Running from your primary doctor to the dentist, and then you have to see a specialist across town. It's a huge hassle. CHC just simplifies all of that. They call it a one-stop shop, and because their whole team is working together, the care you get is way more coordinated and, frankly, just better. So let's break down what that one-stop shop actually includes. It all starts with the foundation, right? And that's high-quality primary and family medical care. Think of this as the home base for a patient's health. But it doesn't stop there. They also have full dental care right in the same place. And this is so important because your oral health is like a window into your overall health. Sometimes a problem in your mouth is the very first sign of something bigger going on in your body. And that exact same idea applies to behavioral and mental health. Having counselors and therapists working right alongside the medical doctors, well, it means they're truly treating the whole person. Mental health isn't some separate thing off in a corner. It's treated as a crucial part of your overall health journey. And what about when you need help right away? To make sure getting care is always possible, they've also got walk-in urgent care. This is so huge. It's a bridge for those immediate needs that aren't quite an emergency, and it keeps people out of expensive and crowded ERs. And the list just keeps going with other specialty services. Things like optometry for your eyes, podiatry for your feet, and so much more. When you put it all together, CHC really becomes this central hub for a person's health, where all the different pieces of the puzzle can be seen and connected. All right, so we've covered who they serve and the amazing range of services they offer. Now let's get to the really exciting part, the actual impact. What does all this work look like in terms of real numbers? First off, their reach is way bigger than you might think. This isn't just one clinic in one city. CHC is providing these vital services across a whole network of 36 different communities. That just gives you a sense of the scale we're talking about. And if you look at the numbers from 2024 alone, man, they tell such a powerful story about how essential this organization really is. Get ready for this. In just that 1 year, CHC cared for over 45,000 individual patients. Let that sink in. 45,121 people who had a place to go for their health care. And those 45,000 patients, they came in for nearly 175,000 visits. That's a mix of seeing someone in person and using telehealth, but either way, it just shows you the massive demand and the incredible amount of care being delivered. And what's really crucial here is that a big chunk of that care was for the next generation. Over 12,000 of those patients were kids and teenagers. That's a direct investment in the long-term health of the entire community. So you can see all this amazing work they're doing, but it's not just about patching things up today. It's really about laying the groundwork for a much healthier future for everyone. And that brings us to their vision for that future. It's pretty ambitious and honestly, really inspiring. The goal isn't just to be a provider, it's to be the leading healthcare center, to actively tear down the barriers that stop people from getting help, and to build that healthier tomorrow for everyone they serve. And really, that leaves all of us with a pretty powerful question to think about. Community Health Connections has their answer, but it's a question for every single one of us too. How do we help build a healthier tomorrow right in our own communities?